I wanted to bring today's episode to the podcast talking about male factor fertility. We are doing a deep dive on all things male fertility today and really talking with a urologist, bringing Dr. Tracy Gapin back on the podcast. He takes an integrative or functional approach with fertility and men's health. So excited for you to listen to this episode. And really, it's a very, similar to our approach with low AMH and high FSH and diminished ovarian reserve and premature ovarian insufficiency. Looking at male factor fertility, it is a similar, very comprehensive approach, that mind, body, spirit, looking at it all, not all at once, but really taking that really layered approach so you can really reverse male factor fertility. Excited for you to listen to this one. I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 4 spots available per month to work with us. I would like to invite you and your partner to a Supercharge Your Fertility Discovery Call. And this call is for you if you meet at least one of these criteria. You've been trying to get pregnant for at least 2 years. You've been through at least one failed IUI or IVF. This calls for action takers. If you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. If you're seriously considering working with us, go to Fab Fertile, F-A-B Fertile, and click on Book a Free Call. That's Fab Fertile, F-A-B Fertile, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. There's a lot of information about which supplements are right for fertility. And like most couples I speak with, you are probably taking a lot of supplements. But are these supplements optimizing or harming your fertility? That's why we recommend professional grade supplements without harmful dyes, fillers, or top allergens so that you can prepare your body in the best way for pregnancy. And as you may know, we take a functional approach to fertility. And while supplements are included in your customized protocols, which are based on testing, they are only part of the equation because there's no pill you can take that will out-supplement the basics, such as poor diet, dysregulated sleep, either moving too much or not enough, and not dealing with chronic stress. So we do recommend basic supplements for both men and women. And these are essential starters that you need to have right now to optimize your preconception health. And I'm excited to offer you a special discount at our Fab Fertile store. You'll receive 15% discount on our professional grade supplements. So simply go to Fab Fertile Store. That's F-A-B fertilestore.com to access the basic supplements so that you can prepare your body for pregnancy success without wasting time and money on supplements that may not be right for you. Go to Fab Fertile Store, that's fabfertilestore.com, and save 15% on your order. Hey there, thanks so much for listening to the Get Pregnant Naturally podcast. And I've got a favor to ask you. If you are enjoying learning about the functional approach to fertility, consider going to iTunes and rating and reviewing the podcast. This is how it helps the show reach more people that are struggling with infertility, knowing that there's another approach that really can get to the bottom of why it's not working in the first place. So all you need to do is, if you're on the app or the desktop, just go in and consider leaving a 5-star rating and leave a review. And there is step-by-step instructions in the show notes showing you exactly how to do that. So if you can just take a few minutes, just take the few minutes right now. You can pause this recording, come back, leave the review. It would really mean the world to me and help others that are on the fertility journey as well. Take care. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently, restored. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's often merely an assumption that's not based on actual evidence. The reason being that there is no direct test of egg quality. You can't test egg quality.
It's the man who's got a food sensitivity or he has a zinc deficiency.
Like, there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why.
And some part of you knows that if you can reframe your journey from not want to struggle, or if it is struggle, learn how to embrace the struggle. Learn how to embrace it.
Most conditions in the child occur during the 9 months of development. It's the genetic switches are turned on or turned off, and they're pre-programmed. So you are in such a powerful, amazing position to do amazing things for your kids.
Why is IVF the first step? because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Tracy Gapin to the podcast, and we're digging into how to optimize male fertility so that you can get pregnant naturally. Dr. Tracy Gapin is board-certified urologist, world-renowned men's health and performance expert, best-selling author, and professional speaker. He has over 20 years of experience focused on providing Fortune 500 executives, entrepreneurs, and athletes a personalized path to optimizing their health and performance. And he incorporates precision hormone optimization, peptide therapy, state-of-the-art biometric tracking, epigenetic coaching, and cutting-edge age management protocols to help men realize their full potential so they can be husbands, fathers, and leaders they're meant to be. His first book, Male 2.0, Cracking the Code to Limitless Health and Vitality, explores cutting-edge strategies to optimize men's health. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Dr. Tracy, excited to have you back on the podcast.
Hey, thanks so much. Glad to be here.
Yeah. So I love when you were on last time. And so we've got a lot of questions kind of coming off that last podcast that you were on. So the listeners definitely go back and listen to Dr. Tracy Gapin's podcast that we recently did. Today, we're going to be digging into it's all male factor fertility. Let's just dig right in. So how accurate are those semen tests and what are you seeing there?
Yeah, great question. I honestly can't tell you the accuracy of those home tests. I know that, that's becoming a very popular item now. And I honestly have not seen the data on it. I mean, I know when I'm in the office with guys and we're dealing with fertility, there's nothing quite as good as actually looking at a sample under the microscope with my own eyes. I know that's reliable, but I honestly couldn't tell you the validity of those tests. I'm sure they have been scrutinized from a QA perspective, and I'm sure they've got to be good, but I haven't honestly seen the data on them.
And what about the ones that you are doing in the office there, like the accuracy of those? Is there any false positives, anything that you sort of see?
No, they're super accurate because when I work with guys in the office, I am actually physically looking at their specimen under the microscope. I can actually count the number of sperm per high-powered field. I can see the motility. I can see a lot of detail of the sperm themselves as well. That's a fairly accurate test for most guys, from a screening perspective.
Okay, perfect. So let's just go into some best practices to ensure that we get a good sample. What do we need to do for that?
Yeah, so I typically recommend that guys abstain for a solid 72 hours prior to producing a sample. Now, I talk a lot about preconception epigenetics. I know that's a big, heavy phrase, but what that means is what can guys do in terms of lifestyle, behavior, day-to-day activities to prepare themselves for, the best chances for fertility. And so I recommend that for, 6 months to a year prior to conception. But especially before a semen sample, it's a really good idea to focus on a lot of that stuff that I'm sure we'll get to.
Absolutely. Okay. So basically just abstaining for 72 hours. What about the transport, all that sort of things, making sure the sample, makes it. And I guess the quantity of the sample. Yeah. What are some things there?
Yeah, I have some vulgar jokes with that, but I'll put those aside and tell you simply a cup suffices. We use a sterile, a urine cup. If you can imagine, we have guys using an empty sterile urine cup and they use that to collect the sample. Guys do it at home and bring it in. I recommend if they are going to do it at home, they bring it in within an hour of collection. After an hour, you start to have decrease in activity of the sperm. And so that may affect the ability to adequately analyze it. But another option that a lot of guys take advantage of is I allow them to collect a sample in the office directly. And that's a much easier way for guys just to be able to collect it, put it in a cup, and then we can analyze it right then and there.
Okay. And so how long do we need to wait to do a retest?
Well, good question. Depends on what we're doing. So we'll talk, I'm sure, a little later about some sample cases and guys I've worked with in the past. I've had guys that come in that have very low testosterone along with azoospermia or no sperm. And so those guys, you're going to not see a dramatic change for, several months. And so maybe you check them again a month or two later, maybe longer. If it's a matter of, inadequate specimen, maybe they didn't abstain long enough, then you can repeat it again a week or two later. But I would not expect to see major dramatic changes in a sample within, let's say, a month or so.
Okay. Because of the life cycle of the sperm, 70 to 80 days. So
yeah, that's right. That's right.
Keep it like that then. Okay. And then, so let's talk about infections and how they impact semen, in particular, yeast or candida. What are you seeing with infections and the impact on semen?
Yeah, good question. Guys who have issues with, STDs, whether it be urethritis, like gonorrhea, chlamydia sort of picture, prostatitis, those sorts of infections can definitely affect a semen sample. A lot of times, if we check a sample, within a month or two of an infection, you may see a lot of white cells. You may see poor motility, sometimes low sperm count as well. I don't see a whole lot of fungal infections or anything like that with the guys from a semen sample perspective, but a lot of issues with urethritis affecting that, prostatitis again. It certainly is important that we treat those infections, make sure they're clear, and then give them some time after that to recheck.
Would you see, you wouldn't see any yeast then being kind of transferred back and forth between partners from if the woman had a yeast infection and then the guy?
Yeah, I'll be honest with you. I don't typically see that.
Okay. And so let's talk about medications and how that impacts sperm. So if you're on like an arthritis medication, or there's a lot of mental health issues, potentially an anxiety or depression medication, the high blood pressure, digestive, like all those sorts of medications, how does that impact the sperm?
It's a great question, and a lot of it, I would say, is complex, and a lot of it's still kind of being studied. I could say, but in general, we do know that a lot of medications can have a dramatic effect on sexual function, on testosterone, on fertility. A lot of it can actually come from CNS effects, meaning central nervous system effects. So if we remember that sperm function or sperm production, I should say, is stimulated by the pituitary and by FSH production. And inhibin actually is the other side of the coin that inhibits sperm production. Anything that affects pituitary function can potentially affect production of sperm. And so a lot of the psychotropics, a lot of the medications that guys take for depression, for anxiety, for mood disorders, that sort of stuff can definitely do it. Blood pressure medications can certainly do that as well.
Yeah, can you run us through maybe a little case study that you had with anyone that sort of had? Because from a functional standpoint, looking at mental health, and then you can maybe, if you want to take the anxiety, depression one or an arthritis one with medication, and kind of what you're seeing there.
Yeah, I actually, you mentioned arthritis. I have had a couple guys who had autoimmune disease, and they were on various forms of immunosuppressants. I had a guy that had testicular cancer actually as well, and he had solitary testicle, and he had actually been on fairly aggressive chemotherapy for that as well, because he had fairly invasive disease or involved disease. And those were challenging cases because those medications can definitely affect fertility, affect hormone function as well. So you kind of got to deal with both. So that's from a medication perspective. Is that what you're thinking? That was looking for?
Yeah, and then I guess from we're looking at, like, obviously from that functional standpoint, that epigenetic side of things, like how do we improve the diet and lifestyle changes alongside that, instead of if the medication may be necessary, but then many times when you make these diet and lifestyle changes, you can actually go off the medication and then in turn improve all aspects of the body.
Absolutely, yeah. So I'm a medical doctor by background, by training, but I have a lot of integrative approaches and perspectives that I bring to the table with these guys that I think are super important from an epigenetic perspective. We know that sleep and stress are something that are not really talked about very much in men's health, but they do have a really dramatic effect on fertility. So sleep, when guys don't get enough sleep, it has a dramatic effect on hormone function, has a dramatic effect on cognitive function. It leads to elevated cortisol, leads to higher blood pressure as well. And all those are going to have a direct effect on spermatogenesis. So I'm really big on sleep hygiene practices, including, number one, going to bed at the exact same time every night. It seems like a fairly simple thing, but your circadian rhythm is so tightly connected to your bedtime. And so I'm really big proponent on picking a bedtime, whether it's 10, 10, 30, 11, whatever time that may be, that you're going to bed the exact same time every day, 7 days a week, and then waking up the same time as well. And that's going to help with circadian rhythm and melatonin and all of the, regenerative, restorative, reparative effects that you get from sleep. I talk about avoiding any blue light. So your phone, your computer, your iPad, even your TV within 4 hours of bedtime can really be harmful when it comes to not necessarily falling asleep, but staying asleep. Sometimes based on genetics, there's certain foods that can really affect your sleep as well, specifically foods that are high in glutamate, which is an amino acid. So for a lot of guys, I recommend they don't eat within 4 to 6 hours of bedtime as well. Typically 4 hours, I think, is plenty. Dark room, cool room, comfy bedding, all that kind of stuff as well. Avoid any light in the room, avoid any EMF near your bed. That kind of stuff is really important for sleep. For stress, which I think is really overlooked as well, I think it's important to emphasize the fact that we are surrounded by stress and that every day in our life there are stressors. And what we need to do is really be cognizant of how we can become more resilient to those stressors. So ways of overcoming, the health challenges, the psychological, the financial, the social, all the stresses we're dealing with, especially in this COVID era, would be things like, number one, breathing exercises. And when I first say that, guys will scoff and roll their eyes and, I know how to breathe, move on, doc. But in fact, it's really fascinating how proper breathing can have a dramatic effect on performance and on tissue oxygenation and on hormone function. And it can certainly affect testosterone and sperm function as well. So breathing through your nose, never breathing through your mouth. In fact, I have guys tape their mouth shut for a while and it freaks them out when they realize that they really are not breathing through their nose like they thought they were. I emphasize slow breathing. James Nestor in the book Breath, which is an amazing book, he talks about that we should all be breathing 5.5 times a minute, which means you're inhaling for 5.5 seconds at a time, exhaling for 5.5 seconds at a time. And you have a tidal volume of 5.5 liters, which is kind of miraculous that they're all 5.5. Most of us don't do that. Most of us overbreathe. We breathe too fast, too high tidal volume, and through our mouth. And that has a dramatic effect on stress levels and on hormone function and immune function and goes down the cascade. So breathing exercises are great for stress. I'm a big believer of mindfulness meditation practices and don't tell any of my other medical doctor colleagues because they'll think I'm woo-woo. But there's a real science behind the actual epigenetic effects of meditation and mindfulness. And so I really think that focusing on stress mitigation and resilience is key, whether it's breathing, whether it's mindfulness practices, meditation, or really just creating time in your life for whatever you enjoy. For me, it's tennis and golf and being with my little kids. I think everyone needs to really, live with intention and create time in their life for what's important, and relaxation time away from work is really critical.
Mm-hmm. No, I agree. And when you're talking about the breathing piece, this is something we recommend the mouth tape to, I guess, if you're snoring. And then many people, when I'll say, oh, let's try some mouth tape. And then they look at me like, oh my goodness, that's insane. Like I breathe out of my mouth, I'm going to die. Like, so
yeah, right.
That's who it is for. Actually, it's interesting because my husband would go to sleep and I didn't think he was breathing through his mouth during the day. I didn't really notice that. And then he's like, oh my goodness, this is what I'm doing. So now he's doing this, doing the mouth taping, and then he's doing the breathing exercises where you have to hold your nose for like 20 seconds and then breathe in and out. And it sounds so strange, but it's like transformed his whole health. It's insane. Just that breathing side of things, because he has dealing with low testosterone. He's had high blood pressure and some cholesterol issues. Like high good cholesterol for years, which are some common things that we see with men and women too. But that breathing piece has really been kind of instrumental with helping some of those.
Yeah, absolutely. It is so overlooked and guys minimize it, but it is critically important and it has a dramatic effect.
Can you talk about that the hypertension, like high blood pressure, like cholesterol, testosterone, like that whole link in there, and sort of what you're seeing with some of your patients?
Yeah, absolutely. So they're all intertwined. What happens when you drink alcohol, what happens when you eat like crap, what happens when you have poor gut health and, a crappy microbiome, what happens when you breathe poorly, what happens when you don't move, all of these, smoke, whatever bad insult to your body it may be, it's a stressor. And what do they do? What do these do? They raise your cortisol level. And there's this concept that I think has been dismissed, this cortisol steal effect. But basically what the concept of it is that steroid hormones are originating from cholesterol, and cholesterol gets converted to pregnenolone, and it gets converted to DHEA, and then finally gets converted to testosterone. Well, another part of that pathway, that steroid pathway, can lead to cortisol production. And so the belief is that when you create too much stress hormone, then that will suck away the precursors from your steroid hormones, and so you'll have lower testosterone levels. In fact, I don't think it's probably as clear cut as that, and I think that cortisol steal concept is probably a little exaggerated. But what does happen is that the cortisol will affect centrally the production of testosterone directly, where it basically inhibits, at a pituitary level, LH production, which is ultimately responsible for that pathway to initiate. And so one of the most harmful effects that I see in men on a day-to-day basis who are dealing with all of these poor lifestyle choices is it leads to elevated cortisol. It leads to insulin resistance. It leads to, ultimately endothelial or vascular disease. And those have a direct effect on testosterone. And so you have lower testosterone, which is related to further cardiovascular insult, leading to chronic inflammation. And they're all kind of intertwined together. And so you have this picture of metabolic syndrome in men where they have this truncal obesity and they have high blood pressure and they have high cholesterol, high triglycerides, low testosterone, chronic inflammation, insulin resistance, and they feel like crap and they look like crap. And, it's where do you start? And this is what I love to do, is work with those guys to take a really deep systems-based approach to overcoming all that. And you can't focus on any one input to that complex network of issues. Can
you talk about the genomics testing that you do and sort of how you're using that to develop protocols and kind of what you're seeing, I guess, from a male perspective? If you're doing a male panel, I'm not sure if you're doing one.
Sure. Yeah. So I'm using a fairly large panel. I use a genomic company called Apeiron, and that's spelled Apeiron, Apeiron. And the Apeiron panel is comprised of 6 sections. There's nutrition, there's supplementation or micronutrients, there's sleep, detox, fitness, and hormones. And each of those sections have a ton of SNPs, which are, in layman terms, genes or short gene segments. But SNPs is a single nucleotide polymorphism, which is a fancy technical term for the actual genetic code of those genes. Each section may have anywhere from 200 to 400 different SNPs that I'm looking at for those sections. And so when I work with guys, one of the first things we'll do a simple cheek swab and send it off to the lab and get their genetic data back shortly thereafter. And now we're able to look at those 6 areas of health and give really specific recommendations. And so I'll give you some examples. So looking at nutrition. So there are genetics related to hunger and satiety, meaning your hunger mechanism. How do you know when you're hungry? How do you know when you're full? And I work with a lot of obese men who we need to figure out why they're obese. And it may be lack of activity. It may be low testosterone or other hormone issues. Sometimes it's because they're eating the wrong foods, but a lot of times they're actually eating too much. And so there are genetics related to the fact that these guys don't have the sensation of satiety. They don't know when they're full. And so knowing that, we can change our approach to how we work with them, knowing that, hey, this is not necessarily what you're eating, it's how much. And we can, make adjustments with fiber or with food choices or with availability of foods, et cetera, or really just coaching and awareness of, where they are. Maybe you want to count calories in those men, whereas others, it's not quite as important. For other men, it's what they're eating. So for some people, the genetics will show that macronutrient ratios need to be adjusted. So for example, I see a lot of guys who come in to see me and they're doing the keto diet and they say it's not working. Well, for a lot of people, your genetics will show that you will actually do better with higher complex carb intake, meaning more than 150 grams per day of complex carbs. Now, I want to be clear, this is not the refined sugars, this is not the cakes, the cupcakes, the Swedish fish, the candy, and so on. This is complex carbs we're talking about here, like sweet potatoes, broccoli, quinoa, oatmeal, other good, clean carbs. And so it's adjusting the macronutrient ratios for those guys to give them more complex carbs than they actually thought they were supposed to be eating to help them lose weight. Same thing with protein, same thing with fat, where we can look at genetics to understand how those influence your metabolism and your ability to lose weight. And that's just nutrition. We can look at genetics related to sleep. There are genes related to risk for sleep disruption, or whether you would do better with an earlier or later circadian rhythm. So, is it better to go to bed 10 o'clock versus 11 o'clock, for example, and wake up, earlier or later? There's genetics related to our body's ability to handle toxins in the environment. And for some people, they can have an exaggerated immune response to toxins. And so how can we reduce that immune effect? Some people need more help with their phase 2 detox. So looking at, glutathione and the other antioxidant systems in our body, and how can we optimize those? Fitness, there are genes related to what type of exercise is right for you. And for some people, endurance training is great. Other people, they actually do better with interval training or strength training. And so knowing that can help us really fine tune the exercise program that we recommend. Even genetics related to recovery standpoint, how quickly do you recover? Some people may need a longer time between sets, for example. And so little details like that are really valuable. So you can see how we can use genetics to really individualize our guidance and our support for these guys beyond just the standard, eat more vegetables and go exercise.
Yeah, and you're finding it's helping with adherence, or it's like, wait a minute, here it is in black and white on the paper. This is, my, personalized. These are my genes. And do you feel it helps with adherence, or how are you seeing that?
Yeah, you're absolutely right. And funny you say that. There was actually a study that came out last year that showed that people who understand their genetics are much more likely to actually adhere to a program or recommendations. So there's direct feedback there because they understand that it's individualized.
And then the toxin piece, I guess someone that's got that kind of that chemical sensitivity where they're, and sensitive to everything like perfumes and things like that, you'd be able to see that there in the toxin panel then?
Yeah, exactly. That's right. And I talk a lot about endocrine disruptors, which are chemicals or toxicants in our environment that are crushing our health, whether it comes to hormone function or an autoimmune disease or obesity or insulin resistance or even cancers. I talk a lot about these toxins and what we can do to eliminate our exposure to them. And so I think, first and foremost is mitigating our exposure to them. And then second would be, how do we upregulate or turn on our body's defense systems to handle those toxins?
And so this back to the diet piece like we see a lot of people too that are doing keto or like the fasting side of things. What's your take with fasting for men? Like for women, sometimes it's not necessarily the best thing, and the cycles can be missed and it can be hard on the system. Like, what are you seeing from men as far as male fertility and fasting?
Absolutely, yeah. I short answer, I love fasting. There are very few things that we can actually show definitive proof that they extend lifespan and promote longevity. And fasting is definitely one of them without question. And so I love fasting for men, especially. I know women, based on their cycle, they can have issues with higher stress and don't do well with it at certain times of their cycle. But for men, I really recommend intermittent fasting on a weekly basis, at least 2 to 3 days a week of fasting. I always tell guys who are just starting, just do 1 day a week at first, get used to it, and then gradually go from there. I personally will do typically 4 to 5 days of intermittent fasting a week. So what does that look like for the listeners? Intermittent fasting is where you will eat within a very small window of the day, and then you'll fast the rest of the day. And so you'll have feeding windows and you'll have fasting windows. Why that's important is your body needs time to repair, recover, basically clear the waste out of your cells. The cellular debris is called autophagy, where you kind of quote, take out the trash, if you will, from your cells. And if you're constantly being fed, your body never has time to do that. And so a typical intermittent fasting pattern is I do 18 hours of fasting, 6 hours of eating. You can start with just 16 hours of fasting and 8 hours of feeding. So what that means is let's say you have dinner and you're done eating at 6 p.m. From then, not eat anything the rest of the evening. You can have water or tea or, any kind of a liquid that has no calories, no sweetener in it whatsoever. And then you'll sleep through the night. You'll wake up in the morning, and then you can skip breakfast. And then at about 10 a.m., which would be 16 hours, you could then start eating again. At first it's fairly overwhelming if you've never done it before, because you're only hyper focused and acutely aware of the time, and oh my gosh, I'm not eating, should I be hungry? After a while you kind of lose sight of it, and now I will sometimes go in almost full 24 hours without even eating, because you just get so used to it you don't even realize you haven't eaten. I do also love a 24 to 36 hour fast about once every other week as well. So for me, it ends up being every other Monday, where I will go full 24 hours. And it sounds intimidating at first, but once you do it a couple times, you get used to it, and it's super easy.
So definitely more for men than women, but so 24 hours, like, are you drinking water or what are you doing?
Oh yeah. You definitely drink water. I actually drink coffee as well. And some hardcore fasters will say, no, you can't do coffee. I'm okay with it as long as you're not using any sweetener. Mm-hmm. Black coffee is fine. I don't use any creamer in it. Tea is fine. Water is fine for sure. But to clarify, for women, intermittent fasting is great as well. There are just certain times of the month where maybe you want to hold off on it, but otherwise it's wonderful. There are proven benefits when it comes to hormone function, when it comes to reducing inflammation, improving metabolism. I want to be clear. This is not dieting. When you diet, when you are intentionally restricting yourself from calories, your body will go into a state of, hibernation is a layman way of looking at it, where your metabolism slows down so that your body can preserve the energy that it thinks it needs. We're not doing that here with intermittent fasting. We're still eating the same, whatever your daily recommended, intake is. We're not changing that. We're just fitting it within a certain window.
So you're stopping at 6 p.m., starting again the next day at 10 a.m. What happens if you start and you wake up in the morning, 7 o'clock or so, and you're feeling a little jittery? Like, is it better to eat before you get that shaky, hangry?
Yeah. So there are certainly nuances of fasting. So if it gets to a situation where you're uncomfortable, where you're having some real issues and challenges and you need something, then break the fast for goodness sake. Go get something and try again the next day. Yeah. I don't want it to ever come across as torture and feel like you're, risking, like you're feeling like you're hypoglycemic and you're going to pass out, but most guys do just fine. Mm-hmm. Most guys are surprised when they realize how long they can go without eating once they just accept the fact that it's not going to hurt you. It can actually help you. Mm-hmm. It's psychological, I think, in most cases.
And then from the hormone standpoint for testosterone and other hormones, what are you seeing? Is there any study or any anecdotal things you want to bring up about that as far as? Yeah,
there's definitely a correlation with testosterone production. There's not a ton of studies. There are a few studies out there that do show a correlation there. When I work with men, I don't just have them do fasting and nothing else. And so anecdotally, I can tell you, thousands of men I've worked with where I've optimized their testosterone, but I'm never doing fasting only in isolation. And so I couldn't tell you anecdotally that was the sole reason for their benefit.
Mm-hmm, mm-hmm, mm-hmm. So it's doing, all looking into sleep, the mindfulness, the breathing, and then sort of then tailoring that as we're doing to the personalized diet.
That's right.
Yeah.
That's right.
The toxins. Okay. And then what about alcohol consumption? I think I think a lot of us know that alcohol consumption is not good for either male or female fertility, but is there any studies that you can think of that talk about how it impacts semen quality?
Great question. I have not seen studies that directly compare alcohol to semen quality. I'm sure there's got to be one out there. I do know that alcohol has a really profound effect on your physiology when it comes to cortisol, when it comes to disrupting your sleep. A great way that I can objectively show my patients the direct effect of alcohol is the fact that all of my guys will have a wearable device that they're tracking their data on. When you're using a wearable device, whether it's a Garmin, an Oura ring, a Whoop, even a Fitbit, a BioStrap, whatever it may be, I'm looking at tracking heart rate variability, or HRV. Now, HRV for the listeners, or heart rate variability, is simply the dynamic variation in your heartbeat from one beat to the next. So if you check your pulse, you go to the doctor and they check your heart rate, let's say it's 70. Well, it's not truly 70. Between each beat, between one beat to the next, it may actually be 70.01, 70.03, 69.98. And that microsecond variation between each beat is what's called heart rate variability. Well, who cares? Why is that important? Well, it's critically important because that variation is actually the end product, the result of this fine balance between your central nervous system's fight or flight end, which is the sympathetic nervous system, and the rest and relax, or rest and digest, parasympathetic nervous system. It's this yin and yang between the two. And so heart variability is a direct window into your nervous system and that very fine balance. Coming back to the alcohol we're talking about, if you look at a wearable tech device tracking your heart rate variability, you may have a baseline stress level that's 16. I'm giving this example because when I give talks, I show this picture of my client's Garmin data from his heart rate variability from one day, which was a Thursday, which showed stress level of 18 or 16, excuse me. And the next day, his stress level is 49. Now, that means, to be clear here, that stress level has gone up dramatically. What that really means is heart rate variability has dropped. So the Garmin is actually giving you an inverse correlate to the heart rate variability data. So heart rate variability that's high is good. That means your system is dynamic. It's able to adapt to the environment. You have high flexibility or variability from a functional standpoint. That's good. When you're stressed, when you've had poor sleep, when you have chronic inflammation, all these negative effects, the consequence is low heart rate variability, low dynamic ability to adapt to the environment. Alcohol alone, one night of drinking, can have a dramatic direct effect on that stress score or on that heart rate variability data point. And you can use your wearable device to see that. Coming back to your question, we know that alcohol has a dramatic effect on our physiologic stress. Not just psychological, but actual body, your physiologic stress. It has to have a direct effect on semen production as well.
Mm-hmm. And what about the person that's like comes in the door? It's like, okay, there could be a habit piece with this of like, oh, I got to have a drink as soon as I come in. But there also could be like a neurotransmitter, something off there, right? Where you're like, oh, the dopamine levels are low. I need a beer to calm down. I'm like stuck up in that fight or flight.
Yeah. So a lot of guys have, that's psychological, first of all. So a lot of guys have a habitual, behavioral pattern issues where they think they need a drink. It's something that, coaching would be very helpful in those guys. For some guys, there actually are dopamine issues, and there are genetics related to dopamine levels and dopamine sensitivity and dopamine receptor function. And so for some guys, there are certain ways that we can approach that very differently, understanding that they have an issue with addiction, issues with, lack of fulfillment. And so some of that's coaching, some of that's supplementation, but it's understanding the individual client and why they're having those troubles.
Yeah, like from a biochemistry, because a lot of times we think it's like the willpower, and I, tried to stop with that whole addiction, which is like, was there epigenetics with that being from generation to generation? But like from a biochemistry piece, which I think that gets missed in all these discussions on mental health. Like, what are you seeing there that would potentially help?
Coaching. I think if there's one simple way, it's coaching. It's helping guys understand that, and I think the first step is just acknowledging, recognizing the issue, and then from there you can make dramatic changes. I see a lot of guys where alcohol is a really big problem, Sarah, and a lot of it is really just behavioral. They just they don't know any better, then hey, I just drink. And so one hack that I've given some guys to help get them to start to make a change is to have one drink and then switch to something else. So for example, if your drink is vodka soda, for example, a lot of guys, one vodka soda becomes 7.
Right.
So my solution for that is we'll have one vodka soda, and then from then on, just make it a soda and drink as much as you want. So now that can't hurt you. So at least you've had that one drink at least quench your quote thirst, and then it's behavioral where they're drinking just for the sake of drinking. And if you put something in their hand that's non-alcoholic, they're going to be just fine. So little hacks like that just to kind of get these guys to turn the corner and start to make a change.
Mm-hmm. And then if there's like nutrient imbalances and things like that, I would need to be able to obviously look from a blood chemistry and then from the genome and things like that, a more of a personalized approach to if there was deficiencies or methylation issues or any of that piece. Yeah.
Yeah, great point. A lot of guys have vitamin D deficiency. That's one of the big things that I would say most common deficiencies from a micronutrient perspective. Yeah. Magnesium is great. Zinc is something very valuable when it comes to sperm function, when it comes to testosterone production, when it comes to immune functions. I think zinc is incredibly important as well. So yeah, absolutely. Yes.
And so you talked a little bit about the environmental toxins. So what are your top hacks to protect the sperm from semen quality from environmental toxins? I'm sitting here with like one of those laptop protectors, but what are you enjoying as far as?
Yeah, that's great for EMF. Yeah, when we're looking at toxins, the number one thing I would recommend is to get a stainless steel water bottle. Mm-hmm. So Simple Modern, Yeti, any kind of those brands doesn't matter, but a stainless steel water bottle. And you need to avoid ever drinking water from a plastic water bottle. We go through, I found the statistic that we go through about 1 million water bottles a minute on this planet. And what's happening in every one of those water bottles is the plastic from the bottle is leaching into the water, especially if it's warm. And those molecules, those BPA molecules, we know crush testosterone production. They cause autoimmune disease, insulin resistance, and several other major health issues. We can look at things like personal care products like soap and deodorant and shampoo and laundry detergent. Anything that's scented especially are loaded with phthalates. And we know phthalates have a dramatic effect on fertility and sperm function and motility and testosterone production. Plastic food containers. So, Tupperware, especially if you heat it up, if you heat your food in any plastic, that plastic is leaching into your food and you're eating it. We know that there's a large volume of estradiol in our drinking water. Now, I always joke with guys, how many of you are on birth control? And of course, none of them raise their hand. And I joke that they all are because we're all drinking estradiol because it does not get filtered very well from our municipal treatment plants. So our water system is loaded with estradiol. And so for that reason, I recommend a water filter. So it could be, a home system. It could be one under your sink. There are even ones that just sit on the counter. And now there are even straws you can get that have filters in them as well. But you want a charcoal or a carbon block filter to get those estrogenics out of your water. So you can see how it's a multifaceted approach to minimize our exposure to these toxins.
Absolutely. Yeah. And you can go to the ewg.org and they'll check out you put your zip code in there. You can see the status of the water in your area and sort of like, oh, wait a minute. Yeah. It's like 300 toxins.
It's scary. Yeah. It's so scary.
I know for years I was drinking tap water. I've become like a water snob. I'm like, no, I only need some special filter. And but right. it just tastes better. And it's actually, hydrating your body as far as instead of putting toxins in it. Let's kind of switch gears a little bit here. So let's talk about, how to improve pregnancy success. Are there any positions that would be better than others? So for sexual positions, we're going to go there. So how to bring the sperm closer to the cervix. your top tips there.
My biggest recommendation is whenever you're done, just lay there, don't move, especially on the woman's part. I used to joke with my wife when we were trying that I would get a turkey baster and fill her up. But I think time is critical. The more time that you can have the sperm near the cervix, I think is valuable. Certainly a female anatomy is going to, the angle of the cervix is going to have some effect there. I would think that that's obviously variable. Position wise, intercourse wise, I don't know that there's a dramatic. I've seen conflicting information on that. I don't know there's a specific angle that's better. I do just think leaving it in there for post-coital for a while, I think, is valuable.
And what about the fact if there is semen, there are issues with the semen, if either it's low motility or count or DNA fragmentation, whatever it may be. What's the take with him then abstaining for one day prior to intercourse? Like what are you seeing there if there's issues, and then how would that help?
Yeah, so that's certainly going to have a dramatic effect on success. I always recommend 72-hour abstaining prior to attempts to conceive. I recommend that you do temperature checks every day for the women, and then when you're getting close, when you start to see that temperature rise, that's when it's time to hit it hard. And at that point, it's every day. But leading up to that, I would try to abstain for 72 hours if they could to increase the volume. Beyond that, you're right, Sarah, that if a guy has male factor issues, then you're gonna have trouble, and that requires that we do an evaluation, we do a semen analysis, and check hormones and go from there.
So let's talk about how fertility medications that are recommended for male factor, and then really some side effects of those medications and what your take is. So you talk about Clomid, which would be a common one. Yeah. So
I've had great success with Clomid. However, it does have the potential side effect that it can cause some mood issues, some mood disturbances in men. There's enclomiphene, which is a variation of Clomid, which I've used in those situations with good success. Clomid itself is great for the guy who is having issues with infertility, and he might have low testosterone as well. I've had a number of guys come in who had both, and that guy, we don't want to give men testosterone replacement therapy if they're struggling with fertility, because that's going to make it worse. That's going to actually inhibit sperm production, not make it better. For that, I've had a number of cases where I'll give them Clomid, maybe HCG as well, and gotten really good results. I had one guy specifically who had, I think he was 31 or so when we started, and he had very low testosterone in like the 100, 150 range, and azospermia, meaning no sperm, and put him on Clomid, put him on HCG, and see him back a month later, and his testosterone levels were definitely better. Some sperm. A month later, testosterone was definitely getting up there, definitely see more sperm. And at 3 months, he had a large number of sperm on analysis, and his testosterone level was in the normal range. In the, what I consider normal, not the ridiculous lab normal range. That guy, we were able to fix his issues, and their baby is now almost 1 year old. So that was a really huge success story. I will say I'm pissed that they didn't call their baby Tracy after me. I still have issues with that, but it was still rewarding nonetheless that I got to, be a part of that and help them conceive. And, his testosterone numbers are normal now as well.
And that doing like a lot of the diet and lifestyle changes is in conjunction with that?
Absolutely. Yeah. That stuff is absolutely critical as well. Yeah. I'm talking specifically the pharmaceuticals here, but absolutely it's critical, an integrated approach that incorporates all of that's really key.
And any other medications for male factor other than Clomid, or what are you seeing?
Micronutrient supplementation. I'm always big on, good multivitamin, omega-3 fish oil, vitamin D, zinc, magnesium, all that kind of stuff I think is really important. I focus on eliminating any other prescription medications that they can get off of it all possible. Ton of the lifestyle work, and I have health coaches that work for me that I employ to work with a guy as well. And it's work, it's a lot of work.
It's rewarding though. Yeah. And so is there anything you're currently obsessed with right now? We're gonna talk about the free copy of your book here, Male 2.0, but anything that you are liking, the book or a website or an app or a documentary, anything you're obsessed with?
I right now, Sarah, I'm obsessed with peptides. I love peptides, and unfortunately there's no peptides specifically for fertility. I wish there was something I could throw your way for the fertility angle. But I love peptides, whether it comes to reducing inflammation, whether it comes to helping with immune function, whether it's musculoskeletal repair or cognitive function or sexual function performance or hair loss or, list goes on, gut health, memory, mood. There are so many peptides out there that it's really amazing. Peptides are not pharmaceuticals. So peptide is nothing more than a chain of amino acids. It's basically a short protein. And peptides are great for very specific functions, and they have very little downside for the most part because they're signals that your body already recognizes. They're basically signaling molecules that are derived from your own internal enzymes.
Let's go back to that hair loss thing for a minute. What if, hair loss with high testosterone? Do you see that?
That's a great question. That does happen occasionally. There are actually genetics related to that. Genetics that have to do with the testosterone, and DHT is a stronger, more potent form of testosterone that it is more intimately involved in hair loss, and there are genetics related to susceptibility to that. I will say, guys who are on testosterone, I think I would say maybe 2% or so have issues with hair loss.
And so, the correlation there with the high, because it's interesting it's like, how many bald guys do I know that they seem to be just very testosterone heavy? I don't know if that's just some sort of little study I've done myself. Yeah. There, a lot of that is related to DHT, and from a genetic perspective, the DHT receptor stimulation at the hair follicle level. And so that's really individualized. Yeah. And so they can get a free copy of your book, Male 2.0, by going to Dr. Tracy Gapin. So drtracygapin.com/limitless. And we'll have a link in the show notes there. Anything you wanted to share with them, Dr. Tracy, about that?
You got it. Yeah. I finished that book last year. That was about a 2-year project for me. And that was my first published book, and I'm proud of it. I think it's first and foremost, it's easy for guys to read, for the lay person who has no medical training to read it and understand it and apply some principles into their life starting today.
Awesome. And any final thoughts for male factor fertility? Anything you want to share?
Yes, it's a systems-based approach. You need to focus on every piece of it. It's not just one single issue. And so look at it from a broad perspective, all the different components that are required.
Awesome. Thanks for your words of wisdom. I love your approach and really how comprehensive it is. Thanks again for coming on.
Oh, you bet. Thanks for having me.
I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 4 spots available per month to work with us. I would like to invite you and your partner to a Supercharge Your Fertility Discovery Call. And this call is for you if you meet at least one of these criteria. You've been trying to get pregnant for at least 2 years. You've been through at least one failed IUI or IVF. This calls for action takers. If you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. If you're seriously considering working with us, go to Fab Fertile, F-A-B Fertile, and click on Book a Free Call. That's Fab Fertile, F-A-B Fertile, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. You may be taking supplements that, instead of optimizing your fertility, may be harming it. That's why we recommend professional grade supplements without harmful dyes, fillers, or top allergens. Simply go to Fab Fertile Store, that's F-A-B Fertile Store.com, to receive a 15% discount on our basic supplement recommendations for preconception health. That's fabfertilestore.com. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice, and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.